everybody. In New South Wales in the last 24 hours, we had 16 new cases of coronavirus. The one positive take from all those cases is that there was one in hotel quarantine and the balance were from existing known clusters or existing known contacts. So the fact that there isn't a new stream of outbreak is reassuring at one level, but I still want to state that the state is on high alert. Please, whether or not you live in a community which has had cases or not, we want everybody to think seriously about what they're doing over the weekend to make sure you avoid crowds, make sure you avoid putting yourself in a situation which will compromise your health or those of others. Think about the number of people you're having into your home. We know from the health advice, we know from what's happened elsewhere, the highest risk activities are those inside your own home or those inside a confined space such as a hospitality venue, and that's why the restrictions from Friday address those issues. The businesses involved have had a whole week to get themselves ready, so there is absolutely no excuse. My conversations with the Police Commissioner and with the regulators is please make sure you throw the book at anybody not doing the right thing. Everybody has had ample notice, and that includes patrons as well as the businesses themselves. We've been very considerate in giving people time to adjust, and there is no excuses from Friday. Everybody knows very clearly what the government's message is, what the advice is, what the health advice is, and we expect everybody to comply. But I do want to thank again literally the thousands and thousands of people that have come out to get tested in the last week, especially those who've come forward to get tested in communities which previously didn't have any cases, in regional areas and also parts of Sydney who until this point in time didn't have community transmission at the level we do. So that is heartening, and I want to thank everybody for doing that. And the next level of compliance, in addition to being vigilant on getting tested, is of course to make sure you stay home for 14 days. This isn't new advice, but it's important advice, because we know the virus has an incubation period of 14 days. So even if you've tested negative initially, but you've been exposed, you've been in a venue where someone with the virus has been, if you've been directly exposed and the health advice is for you to stay home for 14 days, please stay home for 14 days. That's why our hotel quarantine system has worked so well, because you test people early on, they may not have the virus, you test them on day 10 and they do have the virus. And it's so important for that 14 days at home. If you've been asked to do that, please make sure you fulfil that, because otherwise you'll be compromising the health of your family, of your friends, of your loved ones, and more broadly, the wider community. And in particular, to people who are more inclined to socialise than others, please know that even though you may not feel the virus can impact you, although it can, you could be taking it home or giving it to a loved one and then unintentionally causing grief on so many levels. So our message to the community is, firstly, thank you for getting tested. Make sure you keep the testing rates high. The mildest of symptoms, you should get tested. Secondly, if you've been asked to stay home for 14 days, make sure you do. Make sure you consider what you're doing over the weekend. Avoid crowds. Make sure you're COVID safe at all times, and make sure you're taking that extra level of caution. Can I say in the most strongest way that I can that the next few weeks are the most critical in New South Wales since the lockdown earlier in March and April. This is the most critical time for our state. If we manage to get on top of the community transmission at this stage, we have a much better chance of continuing to move forward in a positive way. But the next few weeks are critical. We are not out of the woods by any stretch, quite the opposite. I hope I'm not taking words out of Dr. Chant's mouth, but both she and I remain concerned about the next few weeks. We will remain on high alert, and we have some level of anxiety as to the extent of community transmission, and that's why it's important for all of us to play our part, whether we're a business, whether we're a patron, whether we're a member of a family. That pretty much includes everybody in the state. So all of us are on high alert, all of us have to be aware of our own actions. But I want to thank everybody, because in other parts of the world, indeed in other parts of Australia, community transmission isn't followed up as much as it has been here in New South Wales in terms of the contact tracing and the experts that have been on the case, and I want to thank each and every one of them. But there is a limit to their ability. It also is up to each of us to make sure we're doing the right thing. We know what the high-risk activity is. We know what the health advice is, and it's up to all of us to accept it. And even since announcing the extra restrictions on venues which come into effect from Friday, I'm still not seeing the level of compliance that I want to see from patrons and also from the businesses themselves. But that will change on Friday, because any business that doesn't do the right thing will have the book thrown at them, and if we don't find them ourselves, we expect members of the community to let us know, and or staff members for that matter. I know that there are many staff who are concerned about what happens in their workplace. Let us know, and we will come down hard on those people not doing the right thing, because there is so much at stake and so much on the line for the next few weeks. But again, my deepest gratitude to everybody involved in containing the spread until this point. But our job is far from done. We remain on high alert, and I just ask everybody to play their part over the next few weeks.
So there were 16 new cases of COVID were diagnosed in the 24 hours to 8 p.m. last night, bringing the total number of cases in New South Wales to 3,425. There were 18,465 tests carried out in the 24-hour reporting period. There are 91 COVID cases being treated by New South Wales Health, with 2 in intensive care and 1 is on ECMO. Of the 16 new cases, 3 people were associated with the Crossroads Hotel cluster, who are close contacts of known confirmed cases. 11 people are associated with the Thai Rock restaurant cluster, and these include 1 man in his 60s from Hunter, New England, who is a close contact of that case. 1 person from Western Sydney, who is a close contact of a previously reported case that is not associated with any known cluster, was also identified, and there was 1 case in a returned traveller in hotel quarantine. There have been no additional cases associated with the Batemans Bay Soldiers Club cluster. Investigations are continuing, as we haven't identified the source of that infection in that circumstance, but I would like to thank the Bateman Bay community for turning out in high numbers. So that action of that community gives me good assurance that we're not missing any undetected community transmission. The results of that testing will flow through today, yesterday and today, and in coming days, and that will give me a high degree of assurance that the Batemans Bay community, we don't have community transmission, but we all are very watchful there. There are now 53 cases associated with the Crossroads Hotel cluster, and 37 associated with the Thai Rock restaurant cluster, and 8 cases associated with the Batemans Bay Soldiers Club. The sequencing of the virus has helped us understand that they're all a strain similar to that circulating in Victoria. Now, that's important to note that we don't think they're all from the one person. What they represent is that the virus is similar, and we believe that there were different sources of exposure. We believe that we've identified the source exposure in relation to the Crossroads Hotel. We haven't yet done that with the Thai Rock. We haven't found that missing link, and we may never do that. But we have, and in relation to the Batemans Bay Soldiers Club, we're also continuing to look for the source of infection. In terms of the isolation period, there's been some confusion around our recommendations, and just to clarify this is consistent with what we've been saying. Because we've wanted to take a very precautionary approach in this response, we've actually asked people to come forward to get testing in circumstances even if they've got minimal symptoms and in some cases no symptoms. That's because we've wanted to detect those cases early to give us all the lead time, because we know we can detect the virus before people develop symptoms in that period before, and hopefully before they've been out and about too far. So that's been really useful. But it doesn't, even if those tests come back negative on individuals, if you've been exposed to COVID in those settings and we've asked you to isolate, it is essential that you do so. We don't take that decision lightly, but it means that we've assessed you as having sufficient enough contact for you to be in a high-risk category of coming down with COVID. And at this important time, we want to stop those chains of transmission in the community. So this is consistent. Close contacts have always been required to be in isolation for 14 days from their last exposure and contact with that person, or being present in that venue where we know transmission has occurred. And even if you test negative, if you develop symptoms 3 days later, we want you to get retested because of the fact that you may test negative at a particular point in time and subsequently go on to develop COVID-19. Thank you.
Dr. Premier, isn't what Dr. Chant has just said in regards to isolation, but also what you said about businesses? There's been numerous reports to Crime Stoppers and the police have confirmed they're investigating that the owners of the Thai Rock restaurant ignored isolation orders themselves. Give a message to those.
Oh, look, I can't comment on that. I'm not aware of those specific details if that's the case. But my message to all businesses is you have had, with all due respect, ample time to get your house in order. We have a policy in New South Wales where we want to, of course, manage the virus, but we also want to keep jobs going. And that balance can only be met if everybody does the right thing, including individuals and including businesses. And my expectation is that if you don't do the right thing from Friday, you'll be found out, you'll be fined. And worse than that, if you breach again, you will be shut down. And we do that for public safety. We do that in order to keep our economy going, but also, of course, to maintain and control the community spread. And again, as I said, against my better judgment, we gave businesses a whole week to gear up for this, and it's not very, very onerous. All of us have had to make adjustments in our life. This allows them to continue hiring staff, to continue operating, which is what we want. But at the same time, we need everybody to respect what the health advice is, to keep to the COVID-safe plans, and we know in theory what works. We know what the high-risk activity is. We know how people are transferring the virus from themselves to others. But the missing link is all of our behaviour. The missing link is to make sure that all of us do according to that health advice and take that notice because, again, we know what works, we know what we need to do, we know what businesses need to do. And then there's a component that's up to us. It's up to individuals to make sure they do the right thing within those plans. And my expectation is that everybody must, because not just because the next few weeks are critical, but we have to live with this pandemic. And the best way we can live with this pandemic is for people not to cut corners, not to turn a blind eye, not to pretend they're immune, but really to expect that the next customer that walks into their premises could have the virus. And if you've got good COVID-safe plans, the chance of that transmitting is extremely low compared to if you're not doing the right thing. You're likely to have the virus spread to every single person in that venue if you don't have a COVID-safe plan. Now, that's fact. And we certainly don't want to see that happen because we don't want to have to impose further restrictions. We don't want to have to impose further measures which could jeopardise not just our ability to contain the virus, but our ability to keep people in jobs and to keep communities functioning and to keep all of us having a reasonable life during the pandemic.
In this case, this isn't the general business, this is the source of one of the clusters now with the owners. Multiple reports have ignored isolation orders. What do you say?
Well, look, I haven't seen those reports myself, so I can't comment on that. I'm just relying on the question you've asked me, so I'm not going to comment. Right. So the police know, and they will throw the book at any organisation, any business that isn't doing the right thing, and that's a statement of fact. Because we can't afford lack of compliance. We did try, until this point in time, we did try a self-regulatory approach where we had all of our COVID-safe plans. We asked businesses to download them and to adhere to them. A lack of compliance has now made us go down the compulsory path, and we don't apologise for that. And every business is on notice, every patron is on notice, because we need to make sure the next few weeks in particular continue to allow us to have control of the spread, to make sure those expert contact tracers are able to interview every single person, which we're able to do. But there's always the case that once you get beyond a critical number of cases, your ability to be that detailed is diminished. And we don't want to be in that position because the amount of information we've been able to gather has given us an abundance of caution. We've been able to put up in real time all the businesses or establishments that need to be on alert because somebody with the virus or a direct contact has been amongst them, and that's working well and the community is responding well. But therefore there are no excuses from Friday. Everybody's had ample time to get used to what is required to be COVID safe. And the police and also our regulators, in addition to the police, we have a number of regulators through the Liquor and Gaming Authority, through Service New South Wales, and coordinated government efforts to make sure that no stone is unturned in making sure businesses comply.
Outside of Sydney. From Hunter New England, Dr. David Durham said the other day he would strongly advise anybody from the Hunter New England region to rather stay at home than visiting Sydney at this stage unless absolutely necessary. Would you agree that people in the regions should perhaps not be visiting Sydney at this stage?
I'll ask Dr. Chant to comment on that as well, but I'll say this. We have asked every citizen in New South Wales to monitor their activity in the next few weeks, but over the next weekend in particular, because we know it doesn't matter where you live. The virus can transfer no matter where you are. Of course we worry about it transferring to the regions, but equally people from the regions coming back to Sydney have also been bringing the virus back. So there is no zone which is safe. All of us, my strongest message is that all of us are on high alert. All of us should be monitoring our behaviour. All of us should consider where we travel. All of us should consider avoiding crowds and those high-risk activities, especially over the weekend. And
the message was don't go to the regions. No.
Well, we're not saying.
The Premier was quite strong on that.
Yeah.
Obviously, we're not going down that path.
Well, I've just given you the best health advice, and I'll ask Dr. Chant to comment on that. But the other thing we need to note in a pandemic is that there are always emerging trends which we've not experienced before, and the advice reflects those trends. And the advice we have from Dr. Chant at this stage is for all of us, but in particular, if you know that the virus has been in your community, in particular you should take extra caution. But 8 million of us in New South Wales have to be on high alert. It doesn't matter where you live. The virus can come to your community, or you can unintentionally give it to another community. And I'll ask Dr. Chant to comment on that.
So at the moment, we're asking the community to work with us. This is a critical point. We're concerned that we've had potentially introductions into multiple settings. It's pleasing to see we've detected cases in Batemans Bay, and I was actually pleased that we picked up that case in Hunter area. And it was interesting that for a few hours we didn't actually know. We went, oh my God, could there have been another case that's infected it? And that person was linked back to the Tie Rock cluster. And so they were a close contact of someone who'd been to the Tie Rock. And I think this just highlights how rapidly the virus can move. And so what we're suggesting over this next period of time is, can everyone just reflect on their travel arrangements, their non-essential travel? Can we just limit non-essential travel for the next few weeks? Can we just reflect on the gatherings we're going to go to or host? And can we limit the numbers? As I've said, I would prefer that we reduce the number of contacts to 10 because that's an environment where transmission is more likely to occur when we're in a relaxed environment, where our guard's down, where we're less likely to social distance. So this is a critical time because we obviously have had these transmission clusters in southwestern Sydney and western Sydney. And what we're attempting to do is put the fences up and contain it. And as you can see, when we have a case, we then find that we hope to get to them before they've been infectious and out and about. But often we're still getting cases where people may have been for a few days or a day infectious, and then we've got another ring of contacts. So we're trying to mop up all of the community transmission. Obviously, the risk of community transmission through undiagnosed chains of infection is highest in southwestern Sydney, in western Sydney. But as the Premier said, we can't be complacent. We only know what we know, and clearly we've got to be vigilant in other parts of the state where there may have been introductions into those communities, be it from Sydney or being it from Victoria. This is not an issue of where they came from. My other message to everyone is the single thing you can also do for us is come forward and get tested. I want to see those testing numbers go up. We actually have had quite high testing numbers, but I actually want to see it well over 20, the higher we can get, with high scores around 27,000, it'd be great to see that. Anyone with symptoms anywhere in the state, please make that extra effort and come and get tested.
On Tie Rock, do you have information regarding Tie Rock on people who have tested positive? There's some reports that the management themselves and the owners themselves have tested positive. Do you have any information on that?
Look, I don't have the detail around that. I'd have to confirm that, but we can clearly clarify that in our press release in terms of the nature of the types of whether they were workers at the premise or other patrons.
Just on testing that's happening in Batemans Bay and South Western Sydney, how many of these new infections have been asymptomatic and have just come forward? You know, you wouldn't catch them normally because they were just tested because they were in the area, or does everybody who, all of these new infections, are they all symptomatic?
There's a mix, and sometimes what you describe as having no symptoms is not what a doctor, when they interview you, describe as no symptoms, and so sometimes it becomes a semantic argument with people. Also, we know that there's this period before when you develop symptoms, but what we know is that people that are young can often have a very mild course of illness, and so they can actually present with a little bit of a headache or a bit of a runny nose. Very minimal. They wouldn't even perhaps even describe they had symptoms. They would describe themselves as well, and they're actually out and about socialising. So we've actually taken a very low threshold for testing, as we've wanted to find every case possible at this time to actually contain the spread. And thank you so much, the community. We look at the numbers every day from the communities in southwestern Sydney, and they continue to present for testing in high numbers at the variety of clinics available. And thank you so much, because each of those cases that we announce, whilst they reflect new COVID cases, they also reflect the potential to block chains of transmission. So I see every member of that community who's come forward for a COVID test playing their part in preventing community transmission. So thank you.
On testing, we've seen a number of false positive tests in the Sutherland Shire area. Can you describe how prevalent false positives are, and also instances of misidentifying close contacts for casual contacts, which has had implications for businesses closing? Can you please explain that?
So information changes, so let me just do the fact that sometimes the public health advice, and I'm not going to apologise for this, sometimes the advice from the patron changes, so we get new information that there were different behaviours that happened, or it was an indoor versus an outdoor venue where they were seated. So there might be factors that we actually get new intelligence for. We might verify it with the business that they might say it wasn't a crowded place, and then when we talk to the business or they review some other information, well, they actually know it was actually quite crowded. So information always changes. But having said that, we try and triangulate as much the information. What also changes our risk assessment is if once we start getting cases. So we might have actually thought this environment wasn't very risky from everything we've decided, from talking to the patron who's been there or the person who's the case, and also the business. We might think, well, actually the behaviours don't sound that risky. It actually fits into more of the casual contact. But then we actually get cases. And then once that happens, we actually think, well, actually, there must have been some behaviours or some ways transmission was occurring, or the person may have been particularly infectious, or there may be things that we've missed. And so we'll rapidly upgrade our assessment and get that message out that actually we're going to be treating everyone at this venue as a close contact. And sometimes information changes in terms of who you think infected who, which also informs your risk assessment. Okay, so if I just take you through false positives. Can I just firstly say the testing in Australia is fantastic. We have a very robust system of ensuring that our test results are valid, and so generally the community should have great confidence in the results. But like anything, there are reasons why you can sometimes get what's called a false positive, but there's also times where they can be old infections. So I'll just take you through the various scenarios. So what we know is that this virus can be, our testing's so sensitive that even fragments of this RNA, which is dead and not able to infect anyone, can hang around in people's oropharynx and the nose and throat for months. So you may have actually been a returned overseas traveller, you've come back and you happen to have, you know, you might have a common cold, you might have something else that makes you go to get a test, and then we find this very remnant virus. Now, obviously, even when we get that test result, it could mean many things. It could mean that the swab wasn't that great, so that's why we didn't get much virus particles. It could mean that you've early in the infection. So we have to forensically look at all these test results, and occasionally it will be a false positive, because every test regardless, that you have in clinical medicine, there can occasionally be a false positive. But there's also a number of the tests reflect this older infection. So what we're finding is people who probably got infected back in March or may have been exposed, had infections overseas, we still detect them as positive. And then what we do is we do serological tests on them. And so this actually confirms that it isn't a fresh infection, it's actually an old infection. So that's a category where we say previous infection, which is different again from false positives.
There are reports that the numbers in Victoria could be worryingly as high as 500 today. How closely do you monitor the Victorian numbers each day?
We have a daily meeting of the Australian Health Protection Principal Committee that meets at between 12 and 12:30 every day, 7 days a week. At that time, the Chief Medical Officer in Victoria provides an update of the figures and provides any relevant context or understanding of issues that are confronted in Victoria, so that we can rapidly understand the situation in Victoria and also learn any lessons and incorporate that into our response.
But now that you have the sources of all the 16 today, does that mean that the fear of going to the hundreds is now over for New South Wales?
No, I cannot stress this enough. We need everyone working together over the next 2 weeks, and maybe that's a bit too short, 2 to 3 weeks. But if we can just stop people moving around, stop gatherings, modify those behaviours, it means that even if we're missing an infection, and when I mean missing, this is not a failure on our behalf, it's just that this disease is pretty slippery when it comes to detecting all cases. Even if we don't detect or determine a person to have it, if they haven't been to a social gathering, if they haven't had lots of friends over, the opportunity for them to have spread it to too many people is not there. So in essence, that chain of transmission effectively gets blocked. If that person's adopted good social distancing, hand hygiene, and even if they haven't come forward to a test, which is what we recommend, and even if they've self-isolated if they've had symptoms, then that chain of transmission's actually blocked. So that's why the components of this are so essential, that the community work with us over this time to really reflect on their behaviours. And it's also a time for business to think about their part. And we will do our best in terms of providing testing and doing that contact tracing. And can I thank the people who have, at the other end of those interviews, the people that have actually given forth detailed information about where they've been, that have really assisted us in finding these linkages, because it changes very much our response. As I said, for a period of time we were concerned that the case in Hunter, New England could have been another cluster that we didn't know, a tip of the iceberg, but the fact that we were then able to link it back to someone who'd attended the Thai Rock and that link was established means that we're dealing with a different issue. Obviously that person was also infectious for a period, and then we're trying to mop up any potential contacts that person had, and also will lead us to go back to the source of that and check that there's no other contacts that they had that perhaps had not been recalled.
Can I just clarify common advice? If you've had a negative test result and you have not been to an area with a cluster, are you still advised to isolate?
I would suggest that everyone goes to our website. There is only certain settings where we have said isolate. So that is if you went to that Thai Rock restaurant on the days when we know someone was infectious, and that's because we've had multiple cases generated. So we know they're very high risk events. That the patrons of that restaurant were at high risk of acquiring it. So for abundant caution, we've said you isolate yourself. Get tested, but then isolate yourself for 14 days. So there's a list on our website which goes through those venues where we've had chains of transmission where we're actually saying isolate. The rest of them we're often saying minimise your contacts, just go about your business. If you get symptoms, come forward for testing. So that's the broader list where people may have gone. So there is a distinction. Those settings where we have seen transmission, or where we actually think the behaviours or the risks were very high even from the outset because of our knowledge of the infectiousness of the person, we then urge that self-isolation for 14 days. But it is a limited list. It's not everyone who's got symptoms in southwestern Sydney.
Do you think that masks should be mandatory, Dr. Chant, on public transport?
I think our advice has been very consistent, that we do encourage the use of masks where social distancing isn't available. They're an incredible adjunct. As I said, the other messages we've continued to reiterate is the importance of not going out and about when you've got symptoms. We want you to self-isolate and get a test. We also really want to reinforce those messages about social distancing and hand hygiene, and we see masks as the fourth prong of a strategy, which is really around where you can't socially distance. Masks do prevent transmission and are important complementary activity.
The situation on the Victorian border, a lot of locals are very angry, saying it's chaos. Would you consider going down to the border, seeing what's working and not working for those communities?
We've kept our ear to the ground. I'm in contact with community leaders almost on a daily basis, and we appreciate the frustration, but please also know that when we closed the border initially, there was still in excess of 200,000 permits given. And unfortunately, as you see with the situation in Victoria, we don't have any assurance that there's no community transmission in regional Victoria. Now that puts all of New South Wales at risk. We are, in fact, the reason why we're going to all these efforts is to allow our border communities to continue functioning as a community. But that in itself comes with risk, because as I've said, we can control, well, we try to control what happens on our side of the border, but we have no knowledge, no exposure to the level of community transmission in Victoria, and that's why I appreciate the anger and frustration, but it would be far worse if there were multiple cases of the disease that then went in an uncontrolled area in regional New South Wales, and that's why we have to take this level of caution. And can I acknowledge that Premier Andrews and I have spoken at length about this issue, and he understands our position and supports it. And in fact, I appreciate that for border communities it's very difficult, but the amount of resources, policing, health experts, Service New South Wales, the permits, there's been so much resourcing given to support our border communities. It would have been far easier for us to do what Queensland did to us. We could have very easily said, that's the hard border, that's it. But we didn't, because we respect and appreciate that those communities on the New South Wales-Victoria border have lived as one for a century. We understand that, and that's why we're going to so much effort to support them. And I appreciate there's always a fine line. It's never perfection. But the new system's only just come in, and the Health Minister and I have also discussed, of course, based on health advice. If we need to tweak anything, we will. But in the first instance, you have very good exemptions for work, for education, for health, for essential work. I mean, there's a lot of categories where people are freely still with the permits moving back and forth. And we support that. But even that comes with risk, and we have to be open to that, because we don't know what's happening in those regional communities, and we can't stop Wodongans from going to other parts of Victoria. So therefore, we'd encourage them not to, but we can't stop them. And so please know why we've done this. It's to keep the community safe, and it's to make sure that we do the right thing by the border communities, but also to keep the rest of New South Wales safe, because we know, and I don't want to put pressure on these individuals, but one infected person can have a huge ripple effect, as we've seen, and we don't want that to happen again.
Citrus Australia has...
Full of photos of actress James Seymour in 2 weeks of hotel quarantine at the moment before she goes out and starts some production. We saw Nicole Kidman come in the other day and doesn't have to go into any quarantine. How come some people get favored treatment?
No, I understand that's not the case. The advice I had was the people who granted those ability, apparently there is strict quarantine. It's just a question of where you have that quarantine, and the whole film crew is all in one hotel. So it's essentially, the only issue there was the location of the quarantine. But please know that everybody, it doesn't matter who they are. Can I be very clear on this? There is no exemption for anybody from quarantine, and that's why New South Wales has been so successful. New South Wales has been successful because we've taken a very hard line in relation to quarantine, and that will continue. Everybody has to undertake quarantine. There's no way of getting out of it. I'm sorry, it doesn't matter who you are. but there was just an issue with location as opposed to the quarantine itself. So the quarantine is definitely enforced, and I think I'm not across the details, but all the health people have been all over it with a fine-tooth comb and made sure that that's in place.
Just back to the border, Citrus Australia is saying thousands of foreign workers...
Who's, I'm sorry?
Citrus Australia,
right.
Citrus Industry saying
right.
thousands of foreign workers can't get into New South Wales because there's a ban on visa holders getting permits. They're asking you to reconsider that decision.
Look, this has been a long-standing issue. We've said for seasonal workers, if you're coming into New South Wales, it doesn't matter where you're from, you have to go through 14 days of isolation. I mean, that's been our standard practice and that won't change, and nor should it change, frankly. Anything which is high risk needs to be curtailed. Everybody has to comply. And unfortunately, we know in New South Wales there's no shortage of labour. We know many people don't have jobs at the moment or else are on JobKeeper or JobSeeker. And so we're asking everybody to consider that in terms of their own employment needs, especially young people. A lot of young people have been displaced from hospitality sector or through the airlines. And there are lots of people who need jobs. And so I don't feel there's a labour shortage in New South Wales at all. But if people are keen to come in and want to do that seasonal work, they've got to be subjected to the 14-day quarantine isolation period.
Have you received that letter from Anastasia Palaszczuk? Have you changed your mind about?
I have received the letter. I got it. No, I got the letter at 7 p.m. Day before yesterday, and I wrote back to her yesterday, suggesting that we either maintain the status quo or I'm happy to move the border north into Queensland, but I'm certainly not going to subject New South Wales residents to further ranks. The Queensland border is a decision for the Queensland government, so it's really for them to manage that. And suffice to say, I did not support her suggestion that was put to me about 40 days ago.
You talked about looking after border communities down south, but that is our border checkpoints, whereas up north, that is the Queensland border checkpoint.
Well, the thing is, when we embarked on the Victorian situation, Premier Andrews and I had multiple conversations about that, so we were very clear what that meant and what the strategy was. I've not had that benefit with the Queensland Premier, but having said that, at the moment, our Tweed community is still able to function well and manage that border status. If the Queensland government is having issues with their checkpoint, it's up to them if they want to move it further north. That's a matter for them. But given the rate of lack of community transmission in northern New South Wales, we see absolutely no reason whatsoever why that should move south. If anything, it can move. If the Queensland government wants to move that north, that's a matter for them. But certainly we have no intention of changing the existing checkpoint.
The Australian Sports Foundation report says today that up to a quarter of community sports clubs face collapse without some sort of financial support. They said the black hole's some $1.2 billion. Is it worth considering doing more to support community sport?
Well, look, I've not seen that report, but obviously we've done everything we can to support community sport. We have a number of government initiatives outside of COVID which support community sport. Our Active Kids vouchers have been really helpful in allowing a lot of community organisations to function. But we need to accept that a lot of organisations, especially volunteer organisations, are under a lot of pressure, and I want to thank everybody involved in those organisations who on the main have been really great at taking our advice, especially with the revised health advice around community sport on the weekends in relation to spectators. We thank everybody for respecting that. And I think that the participants, the children themselves, would understand why they can't have a cast of thousands coming to watch them. That's the times that we live in. I want to thank all those community groups who've done that, especially those that are volunteer-based. Look, the governments, whether it's state or federal, are always looking at ways in which we can support our communities, but we also ask our communities to appreciate the unique circumstances in which we are all living, and our priority has to be to protect the health and safety of our residents, but also obviously to keep jobs going, and that's where our resources have to go. Governments unfortunately do not have infinite resources. We are also stretched ourselves, and that's why for us we need to prioritise where we put that support, and our priorities have been health and obviously job creation. I think that's for you.
1 to 2% of the population get exposed to COVID. Can you just clarify exactly what that means?
So when we, and look, this is yet to be validated, and I gave it, I think, as an indicative level when we were comparing it with, say, the situation in America or other countries. So when we look at any system, and Australia has a fantastic healthcare system with great access, but because COVID is a mild disease, not everyone will present for care or get diagnosed. And so what we look at is antibody markers. So when you have an infection, your body mounts an immune response and you have some antibodies. Now, what we know about COVID is not all people mount an antibody response, so that's a caveat, but we do look at these things called serosurveys, and that tells us how many people in the population have been exposed. And we do things like samples of stored serum on pregnant women or opportunistic samples that have been left over in pathology collections, and we build up a pattern or a picture of how many people were infected. Now, that study is being undertaken at the moment and will be reported in due course, but it's an important component of our surveillance plan to actually understand how many people at particular points as we go forward have been exposed, and we also look at whether there's any differential in different age groups.
So does that mean 500,000 Australians could have been infected with COVID?
That I am not going to. I've given those as indicative numbers, about 1%, but that.
1 to 2%. Is that a reasonable?
Well, I'm saying that we would expect it to be, if you were asking me to estimate, I'd say that I'd think probably less than 1%. Now, it's very important to understand that states will have very different data and age groups will have different data, but it would be very low. I think the point to take from that is that we are not in the situation where, for instance, in New York, the serosurveys showed that right in the centre, the population, about 20% of the population has got evidence of antibodies.
Last week you said 1 to 2%. Now you're saying...
I'm saying it might be different in different age groups. So, for instance, I'm just giving that as an indicative sort of example, but it certainly would be more towards the less than 1%. But it's premature. We haven't validated and finalised that work, and like all things, it's important that we get the robust science. I think I was giving as an illustrative example that where our infection rates will be much, much lower than the infection levels that will be in some of the other overseas countries.
Just with the recent cases in shopping centres, are there any concerns about transmission to hand dryers that
Look, I'll get some expert advice on that. That hasn't been raised as a key issue. Obviously, we suggest that hand washing has to be done thoroughly, and we support drying. But let me take some advice about that. I understand the principles of the concern, which is the aerosolisation of the particles, but hopefully they've been fully removed through the hand washing process.
And that presentation that's on ECMO, do we know any details about their ages?
I would have to ascertain that, but we'll put that out in the press release.
Negative test result, Dr. Chant, and you develop a new symptom. Should you get tested again or go into isolation as a precaution, or assume it's the same condition?
Look, we have this discussion with GPs, and I think the reality is if it's just an evolution of the same illness and you've had a test, and then that's probably reasonable. But certainly if you have a period where you're well and you get another symptom, and that's probably one of the key messages we've said to you is throughout this COVID pandemic, you may have to have several tests. So every time you get a new illness that meets the COVID definitions or COVID symptoms, we would like you to have a test and self-isolate it and get that result. And that's why we're so keen to try and promote the SMS text registration, because we want to make that process seamless, because one of our greatest protections is that we have an early warning system. If these cases at the beginning of the crossroads hadn't got tested at the beginning, you can see how it may have delayed us putting this together for a week, and in that time we would have had many other chains of transmission. We've got a whiteboard at work, and I know the issues of whiteboards, but it looks like a spider web, and I think that's the issue. What we're trying to do is stop those chains of transmission and simplify the spider web, and the best we can do that is by detecting that outbreak at the earliest possible time.
Something you said in your opening statement about the sequencing, similar to what's going on in Victoria, but you said not from the same person. Were you suggesting that perhaps the virus that's circulating in New South Wales has all been traced back to Victoria, maybe not the same person, but all from Victoria? So
at the moment, the strains have all been of Victorian origin. What we're saying is how they got here. Obviously, there'll be more sophisticated genome sequencing, comparing where there might be minor variations in the virus, and we need to compare it with more sequence strains from Victoria. But in essence, that's the conclusion, that they are related to the Victorian strains. But we don't think they're the same person. We think they're separate people that have been introduced. Yeah.
And Just an infrastructure question.
Oh, safe ground, yes.
New homes popping up in Sydney's northwestern suburbs at the moment. A lot of residents there are concerned that there's not enough infrastructure to provide this. When will they be getting some clearer time frames? And is it something that you are continuing?
Well, I don't know where to start on that list, but the Northwest Rail Line was built to deal with growth in the northwest sector, and the infrastructure going on in northwest Sydney, in particular roads and transport, has been unprecedented. So the residents of the northwest should have nothing to worry about, whether it's schools, hospitals, roads and rail. There's been record investment and that will continue. And to be honest, that's been one of the positives during the very difficult time we've had in 2020 in New South Wales.